Is coming in. Now, to kickstart the show today, the number of people with diabetes worldwide is expected to reach 643 million by 2030 and 783 million by 2045. The inaccessibility of insulin in Africa has serious consequences both on people and on the health systems. We spoke to Jayasree Iyer, the CEO of Access to Medicine Foundation, on bridging the insulin finance gap.
With diabetes worldwide, and they're especially in low and middle income countries, they can neither access nor afford the insulin that they need. So, I mean, I think it's an extremely urgent issue because the burden of disease, including for diabetes, is increasing. It's a more pressing issue for many healthcare systems in low and middle income countries. And there are new products and players that are entering the market. So it is a big challenge, but it's also the right time for the opportunity to solve the large gaps.
What are the pharma companies doing to expand access to insulin? And how can efforts be scaled up, especially here on the African continent?
Yeah. So companies are addressing access to insulin in multiple ways. And, you know, we've shown in our research the actions of some of the three main insulin manufacturers, Eli Lilly, Novo Nordisk, Sanofi, and a major manufacturer of biosimilar insulins. They are the same as the insulin, but they're generic copies, usually more affordable and hopefully more available also. And, you know, at the moment, what they've done, a lot of the companies, is they are carrying out a variety of initiatives to expand the reach of their products in different countries. But I think the main issue is that the scope, the breadth, the scale of those efforts are still far from the scale of the problem itself. So one of the things that we're pushing for is that we need to be able to accelerate the kind of activities that we have, ensuring affordability, ensuring that some of the new products, including analog insulin that greatly improve outcomes and adherence to taking insulin for people, because this is a chronic, diabetes is a chronic disease and people need to take insulin every single day. So the new products can really improve those kind of situations. And we believe that the pharmaceutical industry plays a major role in addressing that inequity of availability of access by expanding access to the entire insulin products portfolio, including the different types of insulin products. And we want them to register the products in low and middle income countries. We want them to enable affordability for different people living in different income settings. And then we want them to also scale up the supply, especially in countries that the availability of insulin just on the shelf is just very limited.
Just Africa's diabetic population is expected to double by 2030, and the continent is also facing a host of obstacles, especially within the healthcare systems. So how can the governments be able to accelerate to further reduce the gap of access to insulin here on the continent? What can be done? How can the private sector also step in to bridge the gap?
Yeah, I mean, I think the at the end of it, you know, companies lag in registering their analog insulin, and at the end of it, you know, insulin is not registered in every single country that needs access. So, for example, we see that a number of low-income countries around the world, including in Sub-Saharan Africa, do not have these insulins even registered on the market. So it is just not available. So I think, for example, what we're looking for is companies to improve their registration, but they can only do that if countries also accelerate registration and ensure that the regulatory system, the reimbursement system is up to date so that people don't have to pay out of pocket and the products are actually available. You know, in our research, we've also put forward a number of key recommendations for companies, for governments, for civil society to address this particular issue. And I think, you know, we strongly encourage that many governments and companies really look at these particular issues and try to improve access.
Okay, and what are some of the innovative solutions that are available currently, and what works, what does not work, what can be adopted to fast track this here in Africa?
Yeah. So some of the innovative solutions that are working right now, I think are really addressing specific population needs. I'll give a couple of examples. Novo Nordisk, for example, is one of the companies that's really looking at improving diabetes care in low and middle income countries, and they take specific population approaches for children. So, for example, not only does a particular program called Changing Diabetes in Children, support just the access to the specific products, but they also include training of healthcare professionals, establishing clinics, support for patient educations, and they donate human insulin for people, especially those living under the poverty line. And, when you provide commodities like glucometers and test strips and partner with other organizations that bring that forward, you can see that the entire continuum of care that a patient needs for combating diabetes is actually improved overall. So I think that there's a number of activities like that. Another activity I think is, which is really quite an important one that we've identified, is where a company is really looking at sort of the end-to-end solutions to improve the supply of essential insulins, and really building that profile of what does a patient really need in terms of access. There's an initiative called Iyer, which is launched in 2021, and it's a business integrated model, and it's addressing access in 49 countries in sub-Saharan Africa, and it covers capacity, affordability, reach, and empowerment, which are, I think, the four pillars that you need to have when you're improving access to insulin itself. And this, at the moment, has been launched in 7 pilot countries: Ethiopia, Ghana, Cote d'Ivoire, Kenya, Nigeria, Sudan, and Tanzania, and it's addressing these challenges and hoping to scale up. So what we need to see is really fast scale up of some of these initiatives that is working. What does not work is patients still do not have choice, right? They don't have the spectrum of different insulin products that they need to manage the disease properly. And this is why companies and countries need to work together to expand access so that patients have a better choice across the different countries.
That takes us for a short break, but do stay tuned on Power Lunch East Africa. When we return, we'll bring a conversation we had with Kevin Juma, the Africa Forest Carbon Catalyst Director at Nature Conservancy.